And let's move for an approval of the agenda.
Mr. Chair, I move approval of the agenda as presented.
I, Gary Plews, second it.
Okay, moving second for the approval of the agenda as presented. Anything further? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? We move forward with our agenda. Item number 3 is approval of the minutes. Do I have somebody willing to make an action for the approval of the minutes?
Mr. Chair, I move approval of the corrected May 28th and September 24th, 2019 meeting minutes, January 28th, 2020 regular meeting minutes, May 11th, May 22nd, and June 16th, 2020 special meeting minutes as presented.
Do I have a second?
I'll second.
It's been moved and seconded for the approval of the minutes corrected May 28th and September 24th, 2019 meeting minutes, January 28th, 2020 regular meeting minutes, May 11th, May 22nd, and June 16th, 2020 special meeting minutes as presented. Any further discussions on that? All in favor signify by saying aye.
Aye.
Any opposed? The motion carries. Next up is our health officer report. Dr. Stein, if you don't mind, take it from here.
Absolutely. So I don't have everything in front of me because I'm in the car, but thank you for Mr. Chair for letting me give a report. As kind of the top aspect of our criteria is that we want to make sure that we're addressing the pandemic, of course. We're seeing increased cases in Mason County that cannot be explained solely by increased testing. And we're seeing increased the rate of positivity. And also from our case and contact investigations, we're realizing that there is more actual community spread going on in Mason County. And thankfully, we haven't seen the kind of outbreaks through businesses that has been spreading a lot, causing a lot of the spread throughout the state. Thankfully, so we haven't seen a whole lot of restaurant or other types of workplace outbreaks, which is wonderful. But we're still closely monitoring our case and contacts. Our nurses are working overtime to make sure that we are being very diligent with contacting all of our individuals who are impacted. We are working with several other counties in the area to help with some of the communication piece of this. There are certain populations within our community that we're seeing a big rise in cases. And so we're trying to work with our partners to see if there are other ways that we can address these populations. We're also working very closely with our school districts. I've been meeting with the superintendents and other school leaders to try to figure out the most safe way that we can move forward with a potential reopening or kind of what we're going to do in the fall as the school year restarts. Other than COVID, also working hard on establishing a hepatitis C pathway for especially for high-risk individuals to receive screening and treatment for hepatitis C. And in addition to that, also preparing for kind of future planning as my tenure at Mason County is going to be coming to an end at the end of the year. So I want to try to ensure that we have we've come up with a contingency plan and hopefully have a new health officer to replace me before I leave this position. And that's the end of my report. Thanks. Thank you, Mr. Chair.
Any questions for our doctor?
Gary Plews here. You said certain populations. Can you be more specific about that?
We have been seeing a large rise in our immigrant populations, and we are trying to address that within the populations. A number of those populations have language barriers, so we're trying to make sure that we are addressing their concerns in their preferred language, and making sure that those populations understand the role of the public health department and the role of case and contact investigations.
Okay, Thank you.
Any further questions for Dr. Stein on the COVID issue? Hearing none, Dr. Stein, you have a other on the agenda. Is there anything else you wanted to discuss with the group?
Not that I'm thinking of right now.
No problem. All right. Well, I thank you very much, Doctor. We'll move on to item number 5, administration report. Dave?
Okay, so I'll start off with everybody got my from the director's desk. Were there any questions on that? Okay, good. So encourage everyone to go to the DOH COVID-19 dashboard. Keep an eye on what's happening there. I did a video, kind of a data with Dave, where I taught people how to use that, and I think that's helped a lot out in the community with people being aware of the data. It kind of shuts down some of the speculation. So, but please go out and look at that. First thing I have is our health officer search update. As of this morning, I have applications in. We are going to reach out, or I'm going to reach out to the new health officer in Thurston County and see if she would be interested in picking up an extra day a week. But we are starting to get some responses. I sent those out, and what I would like from the board is a decision on, do we want to, as a board, set up a search committee and have me feed this stuff to a search committee? What is the board's preference on that?
Does anybody have a preference on search committee versus just putting it out there?
Dave, this is Kevin. How would you envision that process working, and what do you see as the upside to doing it that way versus how we've done it in the past?
Well, in the past, we kind of used like a mix of that kind of thing. So what I would probably do is once we screen these a little bit, is to reach out to the board, and if we could have an interview panel of 3 to 5 people, maybe 3 plus Dr. Stein would be a good mix. And I'd like to contact these folks, and we'd probably be doing the interviews via Zoom. The 3 I have currently are all from out of state. So I'm not sure. We'll need to have a conversation with them to make sure they understand this is a 1 day a week part-time thing. What is their anticipated involvement, and how are they looking to do that? So, and Dr. Stein, I'll be relying on you. I sent you the applications this morning that I've received so far, so you'll get a chance.
Yeah, I think that, you know, it's a really big priority for me to make sure that the county is well served after I leave. I did receive just in the past 2 days, I've received 3 other individuals who might be potentially interested, or people have suggested that we reach out to a couple of people as who might be interested.
Okay.
So absolutely, I think that it's going to be really important that we work together. I don't know if the best solution is to have a search committee, but I really, especially looking at Thurston and how long it took them to finally have a replacement, it makes me a little bit, I want to be very proactive in finding a replacement for me.
Okay, so why don't we do this? I know you're coming in the office tomorrow. Why don't we sit down with you, me, and we'll go through the applications we have, and then set aside a list of folks that we want to talk to, and try to round up, you know, our best line of candidates, and then I can reach out to the board and put together an interview panel. How's that sound?
Actually, it sounds to me like you were actually requesting it more anyway right now. So if you don't mind, are there any people that would volunteer right now so he could have his committee available?
I'd be happy to participate.
Okay, so we have Kevin.
I would be on it.
Okay, Dr. Stein. Gary, how about you?
Yeah, that'd be fine.
Okay. And Gary?
I would ask that staff, Alex and I also get to be on the panel, since we're working with these individuals.
I will leave that up to your director, if you don't mind. Right now, they're looking for 3 members on the board. I can't because Kevin's already on. We only need 1 commissioner on there. So we'll reach out to our chair and ask them as well, unless, is there anybody else that can volunteer that's on our board?
I'm happy to volunteer to do that, but I would also, let Peggy make the decision on that if she wants to have that first opportunity, or we both can if the size of the group doesn't matter.
If nobody minds for now, we'll just do this because we have them all here. We have our three. So you have Gary, you have Carrie, and you have Kevin and Dr. Stein. Does that work for you, Dave?
Yeah, and I'll reach out to Peggy, make sure that she's aware of what's going on, what's happening. So.
Okay. What else you got?
Okay, moving on down the line. So we're looking at a software. It's called Sarah that allows us to do more efficient contacting. Allows us to, in the morning, we can send out an email or text to all of our contacts and get our updates through that system. So we're not having to make so many phone calls. Our nurses, I have to say this, our nurses have been going like gangbusters since this thing began, and they've been absolutely amazing. The work they've done and the professionalism is beyond what I'm seeing in other health jurisdictions. They have taken this case management very personally, and they're to be commended for it. So Sarah will be a tool. It's free. Alex and Lydia are working on setting that up for everybody, so kudos there. Staffing. We're working on getting some extra staffing. Lydia and I kind of have split that a little bit. Lydia's working on some individual folks and some contracts, especially with those that are multilingual. And then I have been working with a group called Public Health, PHI, Public Health International. And they are a group that actually has approached the state to do contact and a case investigation. The state, let me back up a little bit. Back in the spring, we were told there was be 700 people from the National Guard and 700 folks from DOL. And as we've gotten to this point and things have started to uptick, we've asked DOH for some of those National Guard folks. Well, the National Guard is standing down in a week and going on leave. So that's kind of has gone to the back burner. So we're really researching PHI pretty thoroughly, because the ability we have with PHI is the ability to stand them up and scale them back as necessary. So right now, Clark County is using them. I've talked to Clark County, they love them. Skamania is using them also. What they've done is they took the Clark model and scaled it very, very downward to fit Skamania, which would fit us as well. So I've asked them to send us a proposal based on the Skamania model, and I hope to have that today. Their typical model is one supervisor for every 8 of their employees. They hire locally and they hire the languages that we're looking for. I talked to Kirby Richards from Skamania, and she said from the signing of the contract to first operations was 3 days. So very quick turnaround on getting them up and going. So we're exploring that. And that's good news. And Lydia, I will let you cover who you've got when we come back to your piece there. Schools, let me jump over to that for just a second. Been working with the Mason School District on their safety committee. Dr. Stein's been working with the administrators and principals, and those things are kind of meeting in the middle now. And I think we have a meeting this afternoon or this evening, I think, as I recall. I have to look at my calendar here real quick. Commissioner Trask, that's correct, isn't it? That's this evening? Okay. And this morning, I just got the plans from Dana at North Mason, both their reopening plan and their education plan. So I haven't had a chance to go through that, but we'll be looking at that today. So schools, I mean, there are 1,000,001 details that we're looking at to help the schools get started in the fall. I mean, everything from how do you position the desk, how do you get the kids in the door, buses, what do you do if a kid's sick? There's all these things. The governor came out with some criteria after the schools already started working. I think the schools are kind of going back to their plans and scrubbing them against the governor's latest criteria. And through Dr. States and the team up at Area Command, we'll be addressing that from now until after. This will be a big thing, I think, all through the fall.
And Dave,
yeah.
I think the public health officials are also coming out with kind of more strict guidelines. They're in draft form right now, but I think that the public health is going to be taking a bigger a bigger stance on some of the school guidelines. There's some concern that OSPI hadn't really taken fully into account all of the public health professionals. So they're trying to work with OSPI and to come up with our own guidelines.
Now, is that coming out through DOH or through Wasafo health officers?
Through DOH, I believe.
Okay. All right, I'll be looking for that then. Okay. Let's see, what else? We were talking earlier about Evergreen Trailer Park. We've talked about that before. Board of Health, we're working further forward on that. There's some grant funding that we're applying for. The Board of County Commissioners has already written a letter of support. So what we're looking to do with Evergreen Trailer Park is get them both off of the well water and off of on-site septic and into public water and sewer systems. So that's going to be a project that's going to go. And I think that will help address some things through our RIA 14 project list, because it does a number of things for us. That's water resource inventory areas for those that aren't fully into water work. If we can retire those two large public wells, Group A wells at Evergreen, that helps the Johns Creek flows in that immediate area. If we can get them off of the on-site septic and into a sewer system, we're able to address, they have surfacing effluent, especially when it's rainy out, and nitrogen levels are high underneath that, or in that aquifer underneath there. So we're looking to address both of those things. And I think we can do that in a way that meets some of the criteria that we wanted to do for net ecological benefit from the RIA work. So we're going to have a win-win on that as we get the funding and start moving forward on that. So kudos to the city for helping us out with that. Let's talk about funding for a little bit. We got $102,000 a year for this year and for next year for hepatitis C intervention work. Mason County has a higher rate per capita or per thousand than most places in the state, kind of falling behind King County, Snohomish, Pierce. So we're gonna be working on that. Dr. Stein is working on that with Christina. And one of the thoughts we had was to expand that into HIV as well, because they're kind of comorbidities in a lot of cases. And I think if we do rapid testing with our outreach for Hep C, we might as well do rapid testing for outreach HIV as well. Like I said, Dr. Stein and Christina are working on that, and we should be moving forward with that pretty shortly. As far as public health funding goes, there's $35 million still in COVID response money that has not gone out. And it's different than the money that we have currently in that there's a 30-month time frame that money can be spent. We hope to be seeing that in the next month or so coming out. And Wasafo is actively involved in how that's going to be distributed. We've been talking with some large counties as well as some small counties to try to get some parity in there, because we don't want it all to go to just 5 locations. We'd like to see it go throughout the state, because this virus has hit rural counties as hard as a lot of our larger metropolitan counties. So, and we're certainly seeing that here as well. Overall, there's another $175 million in reserve that could come out, and I haven't heard anything recently on that. We did hear through the grapevine that our current COVID money would be able to be spent through December. We've not seen that on paper yet. So waiting to see that, I mean, giving us another 2 months to spend that would be helpful. As far as funding goes for next year, we're looking on track for our grants. One of the things we're trying to do, if we can get this PHI involved, is maybe get some of our staffing back into grant work where they can be billing the grants and keep our grants up to speed. Obviously, during the pandemic, it's all hands on deck for pandemic response. But what that does is it shorts our ability to bill grants for the work that we should be doing. So looking to cover all those bases. I know that's a lot of stuff, but I'm trying to get Dr. Stein on the road here. So are there any questions?
Hi, this is Peggy Van Buskirk, and I didn't realize the meeting was at 11 today.
Oh, hi, Peggy.
Welcome, Peggy. Peggy, do you have your agenda with you?
I can get it real quick. Sorry about that. I didn't see the time was changed. I normally know the meeting's at 3. Let's see. I'm trying to look for the agenda on my email here. Yeah, I'm not. Okay, maybe I better go to the other one.
It might be on your calendar. If you accepted the meeting, it went over to your calendar probably.
Yeah, I'm opening it up right now, I think. Yes, I have the agenda. Where are you at on the agenda?
We are just finishing up with administration report, Dave Wyndham,
Okay.
and I will turn it over to you.
Okay, so we're now on the environmental health report.
Yeah, good morning, everybody. We've been very busy in EH, supporting our nursing staff, providing guidance to our establishments and licensees. On top of everything, we're trying to maintain our normal services that we provide to the public. So we're juggling, a lot right now, but we're getting through it and managing it as best we can. I wanted to take the opportunity to thank my EH staff and really all public health staff on their dedication to stepping up at this time in this emergency response. I think we're all tired. We're several months into this now, but our collaboration and staff working together has really continued throughout this and still exists. And I think all staff is doing a wonderful job for public health so far. So other than that, you guys have my report. I tried to summarize what we got going on in our programs. And it looks like I got some on-site sewage appointments, but that's later on in the agenda. So does anybody have any questions for me?
I have a question. You said we have your report. I did not get any of the report sent to me, so I would appreciate that. Usually I get them in the mail. I didn't get anything.
Okay, we'll get those out to you.
The Board of Health, and the packet is also posted on our county website.
And Peggy,
Okay,
Peggy,
I did not get that email. So
it was the best one I've ever seen.
okay, so it's on the county website.
Yes.
Okay. I did not get that information in my email either, so, because I looked for it. Okay. I guess we're on to community health for Lydia.
Yeah, I'm unmuted. Good morning, everybody. I sent out my manager's report. Are there any questions on that 6-page lengthy report? Don't hear any. Okay, so in response to COVID, we're getting about anywhere from 5 to 12 new cases a day now, which is starting to become very overwhelming. Especially when we have still a lot of partners calling us constantly for guidance. So we're trying to help create some new tools to help some partners, fire, healthcare workers, things like that, law enforcement, so that they can kind of triage themselves some of these questions, because it's generally people don't really start asking a lot until they think they've been exposed, and then everything changes. So anyway, we're working on some flow charts to help see if that will help cut down the calls to us, because basically my staff needs to focus totally on case investigations every day now. Thanks to all my staff who are working very hard. We're all kind of hitting the wall at this point, especially when we've been working weekends since February, a lot of us. And so we're trying to reach out to different ways to help relieve some of that, so that the staff is only working Monday through Friday, our current staff. And so we're getting somewhere on that. We literally last week jumped cases dramatically, but so did the state. So we're kind of following the same suit. A lot of times it's families, it's a lot more families, yes, but it's then following days, it's all the family members then get tested and then they start coming in positive. So we have to investigate every single one of those. So if you have a family of 9, that's a lot of investigations to do. So just to give you an idea of kind of what it's like. We did talk to the hospital this morning and they're offering us, I haven't even had a chance to tell Dave this, they're offering us some staff assistance, some of their nursing staff that's on furlough. So we're going to step out on that. I'm also have, I think, 5 applications in. We put out an ad to get some bilingual case investigators because I can only do so many Spanish, and when you're getting 12 a day, I can't keep up with it with my own job. So I've got some people, a couple of them look pretty promising, seeing if we can move them on pretty quickly. One of the barriers we're having is the state, as Dave talked about earlier, has offered all kinds of support and assistance, including some tools, but to get those tools operational, I'm finding can take weeks. So we're working on that as well, because all of these people that are going to do remote test calling need to have a way to access the data. And we're struggling with that right now. So I'm going to be on the phone with DOH this morning after about a week back and forth to find out why we still don't have access to some things. So that's been a little frustrating for the staff. We do have one of our interpreters has been working, pretty much jumped on about full time a week and a half ago as we started getting more non-English speaking, and she's been working very hard. And that's Rosa Borhoff, and thanks to her for all the work that she's doing. And I also thank EH staff who has stepped in and taken things off of some of the nurses' plates. Like even answering the phone line and taking the messages off, which is a great help to us to not have to do those things. So we're trying to look at our process a little differently to expedite some things a little bit more and give the nurses the opportunity to focus mainly on interviewing. And each interview can take anywhere from 45 minutes to 2 hours. So it's a lot, just for an idea. Let's see what else. I just wanted to add one thing, Dave, on the Hep C. We're still investigating. There's a very strong sense that they're including WCC's numbers in our numbers, which we've had a problem with that in the past. So we've been trying to kind of get an answer from DOH on that. And of course, because they're inundated right now in COVID, they don't have the staff to dig through some of the numbers is what we're finding.
Okay.
But we believe it's a lot lower than they're saying it is.
Mm-hmm.
And we've been following Hep C for the 20 years I've been here. So we kind of know what it is. So anyway, that's been a problem in the past, and it seems like it's creeped up again, where they're just plunking all those numbers into the numbers. And they do test every single inmate that comes through WCC for Hep C. So those are very high numbers over there. And I think that's all I actually have, unless anybody had any questions for me.
Lydia, a compliment for you. You have done an incredible job. I've heard some incredible things out there. I also want to thank you for this this timeline that is that yours? Did you put that together for us?
Well, I will give credit to the start of that time. Actually, Alex started that when we were doing our daily reports. So I copied it and then added a few more things and updated it because we kind of stopped it after a while. But we thought it might be helpful to you guys to see that. Thank you very much.
Yeah, this is very helpful. I made a copy on my phone and I'm putting this one on my wall. It comes in handy. People ask us a lot. And so thank you for this. Thank you for all the work you've been doing.
You're welcome.
I would add one other thing, just one other challenge that we've been dealing with is that the labs have been taking a very long time, 7 to 10 days to result for the COVID testing, which really does add to more of the strain on the nurses that it'll cause, unless these people are being very diligent with isolating themselves as recommended, it leads to a lot more contacts. And we've been working with the hospital system to find alternative labs to send their these samples to, but it's made public health's job a lot more difficult, and in some cases unattainable, because some of these people might be done with their isolation by the time we get results back.
What about the quick report, the testing that comes back so quickly? Is there any possibility we can bring that to Mason County? Is there anything we can do? Is there CARES money that can go to it? It's huge.
So they are currently using something called BioFire for rapid testing, which is a PCR test. The problem with that is it doesn't, you can't test, the company hasn't allowed testing for only COVID alone. So it tests for all respiratory viruses, and it ends up costing about $1,200 per sample. And also it takes time for Mason to be able to run each sample. So they are using it currently for certain situations, like getting people into nursing facilities, or when they need rapid testing for, emergent surgeries and things like that. But I was actually just at a meeting with St. Pete's in Olympia, and they're having the same issue of delay in getting tests back. And the BioFire, it's a good solution for some people, but especially as we're really encouraging increase in testing as the CDC is advocating, it's not a good solution.
I'll add to that. One of the problems we're having with BioFire, and it's great, and Mason General Hospital is using it for anyone that comes into the emergency room as well, because of the potential of them being hospitalized. So we've been seeing a lot more of them every day. The problem is then it's not being direct. Those tests do not go directly to the state website. So it's putting a barrier for our nurses to be able to get that information, because when you notice the Department of Health's website does not, their numbers do not agree with our numbers. It tends to be, our numbers will be a lot higher. Ours are the accurate numbers. And that's because the state will not report the numbers when a lab test hasn't physically been put into it yet. So that's one of the problems with the BioFire and some of the other ones, is they're not uploading directly. Now the state's trying to work on that, but I don't think it'll be within weeks or months before they get that all resolved. That would help us. One of the problems we're having, huge barrier, the whole state is having this problem, including the state and other counties. And that's that when people test, go someplace for a test, usually their testing information, their demographics go into an electronic medical record. And then when that information transfers over to the lab, it does not include telephone numbers or addresses. So that has created a huge barrier for the state and for the local health, because we get a positive with no phone number and no information on how to reach this person. Something else that we just talked to the hospital about today, they're going to put some staff up and start looking for that instead of us looking for it anymore, because we just can't, we don't have the time, the capacity to do that. So those are some of the barriers, the daily barriers that not only our health jurisdiction, but others across the state, including the state people that I talk to, are running into every day, which makes everything delayed in being able to reach the positive cases. One of the positive things in our county that I really like is Mason General. When they're tested there, which most people are, they're getting a great packet of information. And so far as we're calling, whether they're English speaking or another language, they seem to be following the rules and the instructions they were given. So that's a very positive thing that's happening. So I had to say that. Any other questions?
Yeah, Lydia, this is Kevin. I want to maybe shift gears real quickly from COVID. I think I can't say enough how happy I am with how hard you all have worked on this particular response. And I know that there have been a lot of challenges, a lot of them, both at the federal and state level on testing. So I'm really appreciative of it. But I do want to shift gears just briefly. Your report had a lot of really good information about our substance use mobile outreach, project. And I just maybe want to get a sense from you what that might look like into the fall, whether things continue to increase on the COVID front, or if God willing, they begin to stabilize again, as we saw. Just get your thoughts on what we might be anticipating for some of those challenges into the fall and how you might respond to them.
So our whole behavioral health, my team's all working, but they're not all working on COVID. We've returned some of them now to work on their programs, and the behavioral health section is definitely working on their programs and doing a really great job. Our substance use mobile outreach has never stopped. We took it down to a few hours for a couple of weeks, and that was it. And we've stayed consistent. We've done a little more outreach with the tribes because a couple of the locations haven't had a lot of attendance. And so it's been nice to work with the tribes and some of the other areas, local areas, to figure out what might be the issue. And we've made some adjustments, and actually things have improved. Positive to say, we haven't had one single one of our clients come down with COVID that we're aware of yet. They're practicing social distancing when they're out there. They're educating as much as they can with this population. And we have community partners that have also stepped in, are helping with us be more than just our staff, but we have community partners that are there too. We have a new volunteer to the mobile outreach that is attending every time they're open, and she's a peer, so she has lived experience and is doing a really great job. And she's been working in a lot of different areas of the community and has gotten to know the people. So excited. I think things are going to continue. We also had the new LEAD grant, the Law Enforcement Assisted Diversion program start in the last month, moving ahead well. Things are coming along nicely right now. The different, and I think Commissioner Schutte, you're on that group, but they're meeting together to make the policies and procedures. Olympic Health and Recovery Services is the agency that we contracted with to do the person-to-person work, and they're getting ready. I think they're thinking they can start within another week or two, as soon as the policies are in place. That should divert a lot of people that normally would go into the jail into some kind of case management assistance, sometimes treatment. Excited about that. We also got positioned, a lot has happened in the last 6 months. We've got a position from Olympic Health and Recovery as well. A peer is now replaced Abe in the jail and is there full-time, but we pay part-time the fee. They're working with reentry services for those leaving the jail, and also the medicated assisted treatment in the jail. And they work very closely with the mental health counselor that's from ORS that works there full-time as well. So that's been an exciting change and has continued working. Probably the most change we've seen in the last 6 months with the COVID is to our partners, our mental health and our substance use partners, not being able to do their work the way they used to do that. And that has caused some people to fall out of treatment, I think. So that's been an issue, but we are still in touch with them. They've still been collecting data for our COPE project. So everything's still moved on. We did take our COPE project and move it out one more year to use the funds. So we've got until September of 2021. We got permission from the federal government to do that with the slowdown of things with COVID. So we're excited about that too. So did that answer your questions, Commissioner Schutte? Miss anything?
Yeah, no, I think I think that's really helpful. And one of the things that I also want to point out is, a lot of the focus has been rightfully on COVID response. I mean, that's been the dominant public health issue of this year. But I think it's also really important for us to note how public health staff hasn't walked away from any of the other really critical public health work that has been and needs to continue happening in our community. And so really appreciate that. And I'm excited about LEAD. I'm excited about the peer opportunities that we have in behavioral health and in the jail. And I think that work, is going to keep you more than busy over the next several months, but really appreciate those updates.
Thank you. Staff's doing a great job.
Okay, anything else for Lydia? Okay, let's move on to other business and board discussion. Can you hear me?
Yep.
Okay, so I actually have not had a chance to look at the committee appointments because, as you know, I didn't do the packet. So what is the consensus? Alex, do you have some input?
Yeah, I did email that over to you just now, Peggy. I don't know if you have access to email, but
I don't because I'm at work.
Just to kind of summarize it quickly for you guys. We had 3 appointments that expired in March. I had set up for these appointments to be reviewed at our March Board of Health meeting, which obviously was canceled. So those are passing on onto this meeting. In addition, we had a position expire in May. So we have 4 positions that are available right now. We had 6 applicants to those positions. So the way the bylaws are written, these positions are dedicated to a profession or a specific representative. So, for example, only some of the applicants, so an applicant may only qualify for one, position.
Right, because of.
So the way this kind of sorts out is we basically have 2 designers that are applying for 2 open designer positions. And then we have 1 citizen volunteer that's applying for a watershed representative, and she represents, she has other, she's considered a partner in other water quality agencies as well. So, and then we have 3 applicants to the open installer position. So my recommendation is to appoint the 2 designer positions in the watershed representative position. And then on the installer position, we'll have to do interviews or whatever the board's direction is on that.
I agree with that. And I do remember now looking at these in March. So I don't know, how does the committee feel?
Sounds good to me.
Do I hear a motion?
Madam Chair, I move to approve staff's recommendation on the appointments and to do interviews for the installer position.
I'd second that.
Okay, all those in favor?
Aye.
Aye. Okay. So I guess, Alex, you can inform them.
Yeah, I'll let them know. As far as the interviews go, we have not, or I have not done this before. I don't know if any existing board health members have done these interviews before. So I guess I'm looking for some direction. Maybe Diane, can you help us on that? I don't know if you guys want to assign an interview committee or how you guys want to handle that.
I would recommend, with the size of your board, probably a committee. Otherwise, you're going to have to call a special meeting if you want to do it as a Board of Health.
I don't think that we probably need a special meeting for that. Maybe you can form a committee.
So do we have volunteers to serve on this interview committee?
I'll volunteer, Kevin. Although it looked like Commissioner Trask was getting ready to. I defer to Commissioner Trask.
How many do you need?
I don't know, Alex. How many do you want?
I don't know.
So I don't think that we probably shouldn't have two commissioners on there.
Right.
Yeah.
I withdraw my.
A representative from the city.
So Sharon, Kathy,
That would
and
be
Alex?
Yep, you can, I'll volunteer.
Okay, so Sharon, Kathy, and Alex?
I think that's good.
Yeah.
I think
Great,
that's
thank
good.
you.
Okay, so I guess on to public comments.
I don't know if we've had anybody email anything in, so.
Okay, okay. So even though I was late, I guess we get to adjourn.
I do have one other thing, if I could.
Okay.
So we had a great conversation on Monday with the Washington Corrections folks about how, because there's been a big interest in the community on what's happening with the prison. And they walked us through their program, and they have a very tight program. As an inmate comes in, they're immediately tested. They're put into a separate wing or separate housing area. After a week, they're tested again. After 10 days, then with no positives, then they're moved into the general population. So, and if they come to prison with a positive case, then they're automatically put into a separate housing unit until those cases have passed, and they get moved into the general population. So they've done a great job of screening and keeping that under control at the prison system. I was very impressed with their public health folks and their take on how they're dealing with COVID. So that really relieved a lot of my concerns. They are going to be testing their population, the prison population. We are going to be doing support for them for their staff. So I'm ordering the test kits that will be sent to Mason General. Mason General will be able to test their staff as the prison wants to do routine testing or however they want to do it. But we're going to reserve 1,000 test kits for the prison. And that includes both facilities at Mason General. So.
Hey, Dave, so you're saying that I read an article that said that they were doing this at 2 different prisons to ship in the COVID patients. Are you saying that's not what they're doing here, that they're dealing with just their own?
Yeah, so and they are, but so far they've had 1.
So any other?
Peggy, this is Gary. I just wanted to thank the entire staff for the job they're doing with this pandemic. I know I could call out some names, but I won't. I just want to thank everybody for the hard work they're going through.
Yeah, I feel quite often out of the loop because of it, because you cannot talk to people in person quite often. So I understand, and they're doing a good job with what we can do. Anything else? Okay, I guess we're adjourned. Thank you, everyone.
Thank you.
Bye.
Have a wonderful day.